So inflammatory bowel disease is a condition of the bowel and there's inflammation in the bowel. It's mainly two types, ulcerative colitis, which affects only the large bowel or colon, and is inflammation of the lining of the bowel. And second important one is Crohn's disease, which can affect any part of the bowel. And this is usually whole bowel wall inflammation, and it can be anywhere in the bowel and in the small patches. So that's inflammatory bowel disease. And on the other hand, irritable bowel syndrome is a combination of functional and bowel sensitivity. This is mostly due to some ingredient in the diet, which is upsetting bowel. A bowel getting upset with that because of the sensitivity, and the patient gets symptoms of pain, diarrhea, or sometimes constipation. So these are two completely different entities, and treatments are also completely different. So inflammatory bowel disease, there can be somebody in the family, which sort of patients are more aware that about the symptoms, but mostly symptoms are bad diarrhea or episodes of diarrhea with bleeding, if it's colitis, or significant abdominal pain, which comes mostly after eating and doesn't get usually better immediately or after opening bowels. It is continuous pain. Sometimes if there's inflammation and cause infection to spread outside, it can be fever and severe pain for many days. So main symptoms is, say, abdominal pain, diarrhea, or bleeding with the motion. And these suggest that there is something in the bowel, and then need to see doctor or get investigation as required. So diagnosis depends on what symptoms are, and then tests usually include blood test, stool test, and then if it's colitis, mostly colonoscopy or limited sigmoidoscopy to have a look inside the bowel. Sometimes if it's affecting only small bowel, there's other ways of doing scans, CT scan or MRI scan, which is required to confirm diagnosis or establish diagnosis. If it is colitis, with the camera, usually take some sample or biopsy from that lining of the bowel, which usually confirms diagnosis along with other investigations. So it's mostly for inflammatory bowel disease, treatments are different depending on if it's colitis or Crohn's. And treatment is medical treatment to start with. There are various drugs, including steroids, anti-inflammatory agents, and biological agents. So variety of medications which are decided by specialist doctors that which one to start and how long to give. If there are complications or more problems which are not getting treated with medical treatment, then surgery comes into play. So depending on where it is involving, it can flare up. Acute disease makes one very unwell. Infection can spread, bowel can perforate, bleeding can be significant. So there are various types of combinations of problems which can happen. Usually symptoms can be so bad that one has to go to hospital. But when it's a mild disease, it can be controlled with medical treatment early. But if symptoms are severe, then one can't ignore because it's so devastating that one has to go to hospital, but that can be emergency treatment. And if it's colitis, which has become very bad, perforated, or cause inflammation of the whole bowel, then sometimes emergency surgery is required to remove whole large bowel. For Crohn's, it can cause blockage of the bowel. It can perforate, it can fistulae into other parts of the bowel. So there are a lot of consequences if left untreated, or disease, even sometimes with treatment, if disease is severe, some complications can happen. Yes, it can be life-threatening, especially any complication happening with that. Blockage can cause problems. Bleeding, significant bleeding can cause problem, and bowel can perforate inside, which cause peritonitis and can lead to death as well if it's not treated so quickly. During emergency situation, it has mostly required emergency operation then.